Welcome to this explainer. If you're joining me today, there's a good chance you or someone you really love is thinking about starting or maybe growing a family. But well, maybe you're carrying this heavy, kind of silent worry about an inherited genetic condition. Okay, let's dive into this together. Today, we're talking about a guided, incredibly advanced, and quite frankly, super hopeful path to building a healthy family. It's a medical tool called PGT-M. And my goal today is just to walk you through exactly what this is, using plain language, and hopefully offer you some real reassurance along the way. You absolutely do not need a medical degree to understand this stuff. You just need a few minutes with me. Are you worried about passing on a family genetic condition? If you are, I just want to take a second and acknowledge that you are so not alone and your feelings here are completely valid. The emotional weight, the anxiety of having a known hereditary condition in your family tree, it can be absolutely overwhelming, right? It can make that beautiful dream of having a baby feel, well, incredibly stressful and frightening. But I am here to tell you that there is immense hope. There is a very secure, scientifically proven path forward that literally takes the guesswork out of your future. So the crucial starting point is understanding what our tool actually is. PGT-M. It stands for Preimplantation Genetic Testing for Monogenic Disorders. Now let's break that down into simple, plain English so it actually makes sense. Preimplantation just means we do this testing before a pregnancy ever even begins. And monogenic? That simply means a single gene condition. So, in short, PGT-M is this brilliant diagnostic tool used during IVF, in vitro fertilization, to detect specific single gene disorders in embryos. Think of it as an amazing protective shield, helping to ensure a healthy pregnancy right from day one. Oh, and a quick side note for those of you who have been, doing your own research late at night, you might have stumbled across the older term PGD, or preimplantation genetic diagnosis. Don't let that confuse you or make you think there are two totally different tests out there. PGD is literally just the older name for the exact same procedure. The medical community updated the term to PGT-M recently just to be more scientifically precise. But hey, if your doctor or a blog mentions PGD, just know they are talking about this exact same protective process.
Section 1. Who can benefit from PGT-M?
You might actually be surprised to learn that this isn't exclusively for couples who are struggling with traditional infertility. It's actually a proactive, deeply empowering tool for anyone carrying a specific genetic risk. Families who consider PGT-M often have a known history of severe, single-gene hereditary conditions. Some common examples include cystic fibrosis, spinal muscular atrophies, or SMA, or Huntington disease. And I want to reassure you right now, many couples who use PGT-M are fully fertile. They have absolutely zero trouble getting pregnant naturally. But they intentionally choose to do IVF specifically to access this testing. They're doing it to stop a serious genetic disease right in its tracks, making totally sure it isn't passed down to their future baby. Section 2. Preparing your unique test. This whole journey begins by creating a highly specialized medical blueprint that is tailored completely and entirely to you and your partner. It's personalized medicine at its absolute finest. Because a genetic disorder is caused by a very specific altered DNA mutation, it's essentially a unique typo in your family's specific genetic code, the laboratory has to first design a custom genetic probe. Think of this probe as a highly specialized, custom-made magnifying glass, and it's designed to look for your exact family's mutation and absolutely nothing else. Doctors and geneticists literally custom build this magnifying glass for every single couple that walks through their doors. Now, if the idea of a custom genetic probe sounds kind of intimidating or exhausting, just take a deep breath, because the reality of this setup phase is incredibly simple and minimally invasive for you as the patient. To build your custom genetic safeguard, the clinic simply requires standard blood samples from you and your partner. That is usually it. Sometimes they might also need a quick blood draw or maybe a cheek swab from another family member, like a parent or a child who already has the condition, just to help the scientists pinpoint the exact gene in your family tree. But from those simple, standard blood draws, scientists are able to build your personalized safety net. Section 3. The step-by-step process. Okay, so once your personalized probe is ready, it's time to begin the actual treatment. And I truly believe having a clear, predictable roadmap is one of the best ways to reduce anxiety. So let's demystify exactly what happens in the clinic and the lab. Here's your complete PGT-M journey mapped out step by step. Step 1. You undergo a standard IVF cycle where medications help you produce eggs, which are then retrieved and fertilized to produce embryos. Step 2. The embryologists carefully grow these embryos in a highly controlled nurturing culture in the lab for about 5 days. Step 3, once they've reached the right stage, a really delicate biopsy is performed. And finally, step 4, the genetic material is analyzed using your custom probe, the healthy embryos are safely frozen, and then the best one is chosen for transfer back to your uterus. It's a highly controlled, incredibly precise sequence of events, all designed to maximize your success.
Let's actually pause and slow down on step 2 for a second, because this is a fascinating part of human biology. You might be wondering, when exactly do they do this biopsy test? Well, doctors wait about 5 days until the embryo reaches a robust, advanced developmental stage called a blastocyst. By this point, the embryo's hundreds of cells strong. It's incredibly resilient and organized. They do not test on day 1 or 2 when the embryo is super fragile and only has a few cells. No, they wait until it's robust, thriving, and completely ready.
And what happens next during the biopsy is truly a marvel of modern medicine. When that biopsy is performed, I really want to emphasize just how delicate and precise the scientists are. Check out this incredibly precise number, 5 to 7. That is the exact number of cells they remove for testing. Out of the hundreds of cells that currently make up the blastocyst, they only need a tiny, tiny fraction, literally just 5 to 7 cells in total, to successfully read the genetic roadmap of that entire embryo.
Now, what is incredibly reassuring about this biology, and I really hope this brings comfort to you as a future parent, is exactly where those 5 to 7 cells come from. The embryo at this blastocyst stage actually has 2 very distinct parts. There's the trophectoderm, which is the external layer that eventually becomes the placenta. And then there's the inner cell mass, which is the protected cluster of cells that actually grows into the fetus, your future baby. The bio-C cells are only ever taken from that external layer, the trophectoderm. The inner cell mass is left completely untouched and safe. The part that actually becomes your baby is never ever disturbed by the needle. After that delicate biopsy, the genetic material from those 5 to 7 cells goes off to the genetics lab to be analyzed using that custom probe we talked about earlier. But what happens to your precious embryos while you're waiting for those lab results? Well, they are safely cryopreserved. They are flash frozen, which essentially just hits the pause button on time. They rest safely in the clinic's secure storage while the scientists carefully identify which embryo is the healthiest and entirely free from the genetic condition. Then, in a subsequent cycle, when your body is fully rested and completely ready to receive it, that healthy embryo is gently thawed for transfer.
Section 4. Safety and moving forward.
It is completely natural to feel protective of your embryos. I mean, of course it is. You might be wondering if all this testing and freezing is truly safe. So let's talk about the actual safety of the procedure and those exciting, hopeful next steps toward parenthood. I want to read this quote directly from our source material because it's one of the most important takeaways from this entire explainer. Normal embryo development can be seen after the embryo biopsy. I really want to emphasize this reassuring fact for you. When this procedure is handled by a skilled, experienced embryologist, it is remarkably safe. The embryo heals quickly from the tiny biopsy, it continues to develop normally, and it leads to healthy, beautiful pregnancies. You are not harming your future child's development by doing this. Actually, you're actively safeguarding it. Which brings us to our final point, and a profound question for you to ponder today. How could a clear genetic roadmap change your family's future? Just imagine stepping onto the path of parenthood without that heavy shadow of a hereditary condition hanging over you. Imagine the incredible peace of mind, knowing you've done absolutely everything science allows to ensure a healthy baby. PGT-M, it isn't just some clinical test in a lab, it's a bridge to an anxiety-free pregnancy. I really hope this explainer has empowered you with some knowledge, maybe lifted a bit of that worry off your shoulders, and given you the confidence to reach out and consult a fertility specialist. The journey to a healthy family is absolutely within your reach. Thank you so much for exploring this with me, and I'll catch you on the next explainer.